Now, member states of the World Health Organization formally adopted by consensus the world's first pandemic agreement. The treaty aims to make the world safer from future pandemics.
After 3 years of staunch negotiations, the world's first pandemic agreement was formally adopted on Tuesday by member states of the World Health Assembly in Geneva. The treaty comes in response to the devastating impact from the COVID-19 pandemic, driven by aim to make the world safer from and more equitable in response to future pandemics and more equitable access to vaccines and treatments.
Today, you have sent a loud message that multilateralism not only works, but is the only way to find shared solutions to shared threats. You have made the world a safer place. With this agreement, we are better prepared for a pandemic than any generation in history.
The process witnessed 124 votes in favor, 0 objections and 11 absence. Here's a look at the key points of the agreement. Countries must take progressive steps to strengthen their pandemic prevention and surveillance capacities. Subject to resources, countries are called on to develop, reinforce, and implement pandemic prevention plans. The agreement calls for countries to adopt measures to ensure equitable distribution and global production of pandemic-related health products. Agreement aims to promote technology and knowledge transfers to recognize regional or global centers coordinated by the WHO. Pathogen access and benefit sharing system has been proposed. In an attempt to smooth out the flaws exposed by COVID-19, a global supply chain and logistic network will also be set up for timely and affordable access to pandemic-related health products. Countries now have until May 2026 to trash out the details of the agreements, pathogen access, and benefit sharing mechanisms. Addressing the 78th World Health Assembly, Prime Minister Narendra Modi stressed that the future of a healthy world depends on integrated vision and collaboration.
The health of the world depends on how well we care for the most vulnerable. The global south is particularly impacted by health challenges. India's approach offers replicable, scalable, and sustainable models. We would be happy to share our learnings and best practices with the world, especially the global south.
Prime Minister added that inclusion is at the heart of India's health reforms and technology is an important catalyst to improve health outcomes.
Inclusion is at the core of India's health reforms. We run Ayushman Bharat, the world's largest health insurance scheme. It covers 580 million people and provides free treatment. This program was recently extended to cover all Indians above the age of 70 years.
With this historic treaty in place, the goal is clear: fight future pandemics with greater preparedness and cooperation that is in sync with India's shared commitment on building a healthy planet, leaving no one behind. With agency inputs, Tripti Tripathi for DD India.